So my name is Gerard Cox. I work here at the Firestone Institute for Respiratory Health in respiratory medicine with a specific interest in pulmonary fibrosis. The next step after we consider the diagnosis is to understand how it's affecting you. The lungs really do two things. They take air in and out, and secondly, they transfer gases from the air to the blood, which would be oxygen, or carbon dioxide from the blood into the air, because carbon dioxide is a waste product of us being alive. Oxygen transfer is more effective than carbon dioxide transfer, so the first thing we look for is your oxygen levels. We look for those at rest, which is very simple. That's an oximetry reading on the finger. And then we look at oxygen levels during exercise and see that they drop when you walk or exercise on a stationary bike. That's called an exercise test. We measure how big a breath you can take by doing a simple breathing test called spirometry, or usually at least once at the beginning, where we do full or complete pulmonary function testing, which allows us to measure your breathing volumes as well as the resting lung volumes and the strength of your breathing muscles and other things like that. So we measure how you're affected by seeing how your lungs work. And then the other thing we do is we assess how much the lungs are affected by doing a CAT scan, a CT scan. And if you haven't had one of those done already, we'll be doing a CT scan, because the way the lungs are affected, the pattern of involvement in the CT scan is very informative to us. An X-ray is good enough for telling us is there a problem, but if we want to know what type of problem you have and how extensive it is, a CT scan is much more informative. So that would be the third area that we would test imaging with the CT scan. IPF cannot be cured. There is now a drug on the market in Canada that is indicated for treatment of pulmonary fibrosis. It doesn't cure pulmonary fibrosis. Its effect is to slow down the rate at which the illness progresses. The drug is called pirfenidone, that's the chemical name, and the trade name is Esbriet. We do advise most of our patients with pulmonary fibrosis to take N-acetylcysteine, or NAC as its initials are, NAC. This is an antioxidant available in food stores. It has very few side effects. A lot of people take it just because they want to take something that is an antioxidant and they believe that will help them. And there is some evidence from Europe that N-acetylcysteine or NAC can help reduce the rate at which pulmonary fibrosis deteriorates. So we would often advise our patients to take that also. When the illness progresses to a point that a person has great difficulty breathing at rest and has low oxygen levels because oxygen can't be transferred from your breath into the bloodstream, we consider lung transplantation. That's not done at this centre, it's done in Toronto, but we would very often refer patients to Toronto ahead of time to consider whether lung transplantation is a good option for them and for the transplant team to assess our patients well ahead of time before it becomes a necessity. There are no things that you can do that's going to make the disease go away. You or I can't make the illness go away. We can't cure it. The impact of the disease on you is mostly to make it difficult for you to exercise. And it's very important that you hold on as much and as long as possible to your exercise capacity. And this you would do by remaining active and staying out and about and pushing yourself to be sure that your muscle stamina and strength and endurance is as good as it can be, and that whatever limitations you have are caused by your breathing, not by any other part, your circulation or your muscles or your joints. So from your point of view, being active is a very important part of maintaining your health for as long as possible. I'm glad that you brought it up, because it is essential that people with pulmonary fibrosis don't continue smoking if they've ever smoked before, because smoking can make this disease worse as well as cause other diseases that, if they occur along with pulmonary fibrosis, make everything worse. So not smoking is also a very important part of maintaining respiratory health over time. We strongly encourage that people use mainstream, well-respected sources for information. So these would include the Lung Association, Pulmonary Fibrosis foundations either of Canada or the United States, and then large universities that have a good medical reputation.